So when we're going to go through your process of care plan, and this is just explaining all of the things that we discussed today, the findings that we found, and also some recommendations for your home care. So going through, you were an initial appointment, and we went through and explored your teeth and decided that you were a class 2 calculus. We also recognize that you have gingivitis, and you do have a medical alert for penicillin, which you're allergic to. You don't have any specific special needs, and your chief complaint was cavities, but as we went throughout, we only saw one suspicious spot, so you were looking pretty good. When it came to the dental diagnosis, some problems that we just want to address are the anterior lingual swelling that we saw, which is just on the inside of your gums, and that was really just due to the heavy calculus buildup, or the heavy deposits, so we talked about how you can have plaque, and if plaque sits there for a while, then it becomes calculus or tartar. So moving on from that, we also noticed some minor jaw popping that you had, just related to TMD, temporal mandibular dysfunction. And you mentioned that you had had some bone resorption that you had been diagnosed with previously. Is that right?
Yeah, that's right.
Okay. Also, we noticed some minor staining throughout, just from coffee and high sugar colored beverages. And I also noticed that you had deep occlusal pits and fissures, which are just the anatomy of your teeth. So whenever you had your mouth open and I was looking at those surfaces, just right on top where your teeth come together, that was what I noticed there. And that was where we noticed that one suspicious spot that we talked about too. In regard to your radiographs, we did do a full mouth survey, and I have those pulled up here. And as we discussed, we will be doing retakes on these, but we're waiting for the doctor to get back to us on that. But I wanted to point out a couple of things while I have you here. So whenever you look at this, it's kind of hard to see, but you can see the wider outline on the tooth. That's going to be the enamel of your tooth, which is the hard outer surface that you can actually remineralize. So if you do have a suspicious spot on your tooth, and you're like, oh my gosh, I think I have a cavity. If it's not too deep and it hasn't broken through that outer layer of enamel, you can remineralize that with fluoride in toothpaste. The inner layer here is going to be the dentin, which is just that inner layer, and then you also have the pulp, which is like that houses all the nerves and the sensitivity that you can have. Aside from that though, I didn't notice any spots, didn't really notice any spots that seem to have had potential cavities. It's hard to see because we're looking at a 2D image for like a 3D structure, so it's a little difficult to see. But if you look close, you can see itty bitty offshoots, like right in between your anterior front teeth here, and that's calculus. So that buildup that we talked about, they kind of look like little spikes just sticking off your teeth, and it's really hard to see because really you don't have too much.
Right.
But sometimes you can actually see them on the radiographs. So moving on from that, no anesthesia is required for your appointment, but we are going to debride your entire mouth, so upper right, lower left quadrants. And so far, we are just going to use a hand instrument only, so no ultrasonic or anything powered at this point. No chemotherapeutics are going to be required, and we will be getting to a cup polish or two today. So that'll make sure that we smooth out all the surfaces so that the bacteria can't hold on to it. When it comes to fluoride, I'm going to recommend that we do an APF solution, and that's because you don't have any restorations or anything, so it's not going to discolor your teeth or anything like that, but it's just kind of our go-to that we use.
Okay.
And it'll be a tray method, and we'll get to that later. We did recommend that you had a sealant done on number 3, which was a suspicious spot that we saw. But then again, that's up to your discretion if you want to move forward with that. We're not going to use any study models, and we're not planning on using any desensitization methods because you don't have sensitivity. And then we'll see you in a year and a day from now, and it's just for your routine cleaning because you're looking good. We don't have any referrals, any special need modifications. But moving on to your self-care recommendations. So I've recommended that you go for an electric Oral-B toothbrush. You can use Philips, you can use other brands as well. It doesn't have to be Oral-B. I really like the Oral-B though because it has the round head, and so you can get all of the interproximal surfaces, like the in-between spots. If you don't want to go that route, then we welcome a soft manual, just hand toothbrush. It's just a little bit trickier because you do have to have a little bit more dexterity whenever it comes to using a manual toothbrush. But as we discussed in our oral hygiene instruction, you're just gonna use the Bass method. And the Bass method is gonna be like those round circular motions throughout your teeth like we talked about. Also, we're gonna recommend that you use the C method whenever it comes to your flossing, and an oral irrigator too, which you've purchased that as well, haven't you? And so that'll be great for helping get your gums clean and clear out that gingivitis. Whenever it comes to other types of flossing methods, you can use a threader through your lingual retainer that you have, and also a holder to get those back teeth too, because sometimes those are a little bit tricky to wrap your fingers around. And then we recommended tape floss because we want to make sure that you can get through those tight spaces because you do have some really tight contacts.
Right.
Moving on, initially we had discussed that you would use Sensodyne Clean Mint, just because I knew that we were going to be going a little bit. It's a little bit subgingival, some of your tartar that you have, and so I just, in case you had any sensitivity, that's where I was kind of going with that. But I know that you have actually been using some of that and that you noticed some tissue sloughing. So because of that, we went ahead and changed your plan, and we're just gonna switch to the Colgate Gum Health instead of the Sensodyne, which you've already agreed to and I've signed, and so if you can just sign that for me really fast. And I'm choosing the Colgate because I know that you're already familiar with that and that you haven't had any allergic reactions to it, but it's still gonna be working on the same process of helping your gums get healthy again.
Right.
Okay. And the mouth rinse, over-the-counter Listerine, alcohol-free, which is what you've been using anyway, so that should be good and consistent and help you. And then our expected outcomes are just to maintain the oral hygiene and reverse the gingivitis that you have on the maxillary and mandibular lingual, so the top and the bottom, like toward the tongue area.
Right.
So aside from that, do you have any questions for me regarding your plan? Okay.
I don't.
Okay, well then we will move forward with that, and thank you.
Yeah, thank you.